don't notice it all at once. At first it seems like she's just tired, just getting older, just having an off day. But then you catch yourself looking at her differently, longer, more carefully, and somewhere inside you already know. This video is for you, not for people who want to be told everything is fine, but for people who want the truth so they can still be there in time to be present, in time to make the right decision, in time to say what needs to be said. Today, I'm going to walk you through 9 signs that a dog may be nearing the end of life. Some of them are obvious, some of them most owners miss entirely, and I'll explain what's behind each one from a veterinary medicine standpoint. Not fear, just real physiology, because understanding isn't giving up, it's being ready. I'm Dr. Demi. I'm a veterinarian. And before we get into this, I want to say one thing. This is one of the hardest topics I deal with in my work. Not because it's medically complicated, but because behind every conversation like this, there's a living creature that someone loves. Everything you hear in this video is grounded in evidence-based veterinary medicine, clinical research, palliative care data, and years of practice. I'm not going to soften this, and I'm not going to make it more dramatic than it needs to be. Just honest. Before we get to the signs, there's one important thing you need to understand. Dogs can't complain the way we do. That's evolution. In the wild, showing weakness attracts predators. So animals hide pain, fatigue, illness, instinctively without thinking. Even the most domesticated, most pampered dog carries that mechanism inside. What that means is, by the time signs become visible to the naked eye, the process has already been going on for a while, sometimes for a long time. A study published in the Journal of Veterinary Internal Medicine found that owners notice clinical signs of chronic disease in dogs an average of 3 to 6 months after those signs actually appear. Not because owners aren't paying attention, but because dogs are very good at masking. This is not your fault, but it's important to know. Let's start with something that seems obvious, but is often misread. When an older dog starts eating less, most owners think, well, she's aging, her appetite is lower. That's normal, right? Partly, yes. Metabolism does slow in senior dogs, and caloric needs decrease. But there's a difference between eating a little less and losing all interest in food entirely. Here's what happens in the body as a dog approaches the end of life. Organs begin working less efficiently. The liver, kidneys, gastrointestinal tract. Chronic nausea sets in. Food stops being associated with anything pleasant. And the dog simply turns away. Research in veterinary palliative care shows that significant weight loss, more than 10% of normal body weight over a few weeks, is one of the most reliable clinical markers of terminal disease in dogs. What it looks like at home, you notice ribs you couldn't feel before. The bowl stays full. The favorite treat that used to make her go crazy. She sniffs it and walks away. One specific example, a 12-year-old Labrador. The owner noticed he stopped coming to his bowl in the morning. She thought he just wasn't hungry. 2 weeks later, he had lost nearly 5 pounds. Blood work showed stage 4 kidney failure. That doesn't mean she should have panicked sooner. It means that signal was worth noticing. All old dogs sleep more. That's a fact. But there's a point where sleeping more becomes something different. I call it withdrawing from life. The dog isn't just resting. She stops responding to the things that used to bring her alive. You walk into the room. She doesn't lift her head. You pick up the leash. She looks at you but doesn't get up. You call her name. A pause. Then a slow glance. Then nothing. This isn't laziness. This is the physiology of a body that is shutting down. When the body begins to fail, it redistributes energy. Everything goes toward maintaining vital functions. The heart, lungs, brain. For movement, interaction, play, there's nothing left. A study published in Veterinary Clinics of North America describes this pattern as one of the earliest and most consistent indicators of declining quality of life in terminally ill dogs. The authors note that changes in activity level, not pain, not weight loss, are most often what attentive owners notice first. How do you tell normal aging fatigue from something more serious? Ask yourself one question. Does she still have at least one good moment in her day? A moment when she perks up, looks at you with interest, wags her tail? If those moments have disappeared entirely, that's an important signal. This sign causes owners a particular kind of pain because it feels like rejection. A dog who has slept beside you her whole life starts going to the far corner, under the bed, into a closet, somewhere no one will disturb her. This is not resentment. This is instinct. In the wild, animals animals go off alone to die. It's a protective behavior wired into neural circuits over millions of years of evolution. Your dog is not pushing you away. She's following something ancient and unstoppable. Research in animal behavior shows that social withdrawal before death is observed in the majority of mammal species and is linked to changes in central nervous system function, lowered pain thresholds, altered sensory perception, general cortical inhibition. What this means practically: don't try to force her back to her usual spot. Give her the choice, but stay close, just in the same space, without pressure. Dogs who retreat to a corner often still want to feel your presence, just not your touch. The ball she used to chase for an hour, her spot on the couch, the walk that used to send her spinning by the door. When a dog stops responding to the things that used to bring her joy, that's one of the most important quality of life signals there is, and one of the things that most often leads veterinarians to consider having the end-of-life conversation. In veterinary palliative care, there's a quality of life assessment tool called the HHHHHMM scale, developed by Dr. Alice Villalobos and widely used in clinical practice. One of the 7 categories is happiness. The vet assesses: does the animal respond to things that used to bring pleasure? Does she recognize the people she loves? Is there any interest in the world around her? When the answer to all of those becomes no, that's not just sadness, that's a medical indicator. I tell owners often, you don't have to wait until things are catastrophic. The loss of joy is itself a loss, and it matters. This is the one that frightens people most, and rightly so. It can't be ignored. Normal resting respiratory rate in a dog is between 10 and 30 breaths per minute. Remember that number. When breathing becomes concerning, it speeds up at rest, becomes shallow, you hear crackling or wheezing, the chest is working too visibly, the belly pulls in with each breath, or, and this is important, you notice long pauses between breaths. That last one is called agonal breathing, irregular, gasping breaths that occur when the brainstem loses control of the respiratory center. It means the end is very close, hours, not days. According to the American Veterinary Medical Association, labored breathing is one of the leading indicators of suffering in terminally ill animals and requires immediate pain management or an end-of-life decision. Practical tip: count your senior dog's breaths once a week while she's sleeping. Just 60 seconds and the number of breaths. More than 30 at rest. Call your vet today. Nobody wants to talk about this, but I'm going to. When a dog who has been house-trained for years starts losing control of her bladder or bowels, that's not a behavior problem. That's the nervous system losing its grip. The bladder and bowel are managed by a complex network of nerve signals between the spinal cord and the organs. As the central nervous system begins to fail, those signals break down. The sphincters stop working reliably. The dog can't control it and often doesn't feel it happening. I've seen owners get frustrated with their dog in this moment. That's an understandable reaction. It's unexpected, there's cleanup involved, but here's what matters. The dog knows. If she's still conscious enough to be aware, she's suffering from this too. She's embarrassed in the way dogs can be embarrassed. Tail down, won't make eye contact, shrinks away. Incontinence alone isn't automatically a reason to make an end-of-life decision, but in the context of other signs on this list, it significantly changes the picture of quality of life. Some dogs go quiet toward the end of life. The barking that used to fill the house every time the doorbell rang just stops. She lies there and looks. Others start whining or howling for no visible reason, sometimes at night, sometimes in complete silence. Both are signals. Silence can mean apathy, general fading, loss of interest in the world. Vocalization, most often pain or neurological disorientation. Senior dogs frequently develop cognitive dysfunction syndrome, the canine equivalent of dementia. Research published in the Journal of Small Animal Practice found that cognitive dysfunction is diagnosed in approximately 28% of dogs between 11 and 12 years old, and in more than 68% of dogs over 15. One of the manifestations is nighttime vocalization. The dog wakes up, doesn't know where she is or who she is, and cries out of fear. If you're hearing something like that, it's not quirks. It's suffering that can and should be relieved medically. Talk to your vet about sedation or pain management. This sign is one of the most clinically precise, and one of the ones owners almost never check. Check your dog's gums right now. They should be pink and moist. If you press your finger on them and release, the color should return in less than 2 seconds. That's called capillary refill time. As the body begins to die, circulation centralizes. Blood pulls away from the periphery toward vital organs. Gums become pale, gray, or take on a bluish tint. Refill time increases. Paws feel cold to the touch, especially the tips. This is a sign of cardiovascular shock or critical circulatory failure. If you see white or gray gums, that is an emergency, not in the morning. Now, a bluish tint, cyanosis, means the blood is not carrying enough oxygen. That is the final stage. I know how that sounds, but let me explain. Over years of practice, I've noticed something that's difficult to explain in purely physiological terms. Dogs at the end of life change in the way they are with the people they love. Sometimes it looks like a goodbye. A dog who never really sought contact comes over and rests her head in your lap, looks at you for a long time, doesn't ask for anything, just exists beside you differently than she used to. Sometimes it's a silence that doesn't feel like sleep. I can't give you a neuroscientific explanation for this, but I've heard this story from owners too many times to call it coincidence. A study from the University of Lincoln, published in Animal Cognition, found that dogs are exceptionally sensitive to the emotional state of their owners and can read signs of distress with an accuracy unavailable to most other species. It's entirely possible that this process works in both directions, and that dogs signal their own state in ways we haven't yet learned to formalize. If you feel something, trust it. You know your dog better than any veterinarian does. I can't end this video without addressing the question that sits behind everything we've talked about. If you recognized your dog in this list, you need to talk to a veterinarian. Not because it's over. Sometimes symptoms are treatable. Sometimes quality of life can be meaningfully improved with medication. Palliative care for animals is a real and growing field of veterinary medicine, but sometimes the conversation is about euthanasia, and I want to say something important about that. Euthanasia is not giving up. It is not a betrayal. According to the American Veterinary Medical Association, it is an act of veterinary care intended to relieve suffering. Suffering, not life. Research in veterinary palliative care shows that dogs with terminal illness, when allowed to die naturally, spend their final days in a state of pain, nausea, and anxiety, which we can see but don't always manage to relieve in time. Vets don't make this decision for you, but we can help you understand what your animal is actually experiencing. And I ask every owner in this situation one question: does she have more good moments than bad ones right now? That's not a medical protocol, but it might be the most honest guide there is. If you want a concrete tool, look up the HHHMM Quality of Life Scale by Dr. Alice Villalobos. 7 categories: pain, appetite, hygiene, happiness, mobility, the number of good days versus bad. Fill it out. Then talk to your vet. Here are a few concrete things that can make the final period easier for your dog, if that's where you are. Comfort first. An orthopedic bed if there are joint problems. A warm spot without drafts. Food and water within easy reach. Don't make her walk across the house. Don't change things unnecessarily. Familiar smells, familiar furniture, your voice. These are her anchors to reality, especially if there's any cognitive decline involved. Let her choose. If she wants to be alone, let her. If she wants to be close, be close. Don't take her for walks for her own good if she doesn't want to go. Respect her pace. Write things down. Keep short notes. Ate this much today. Got up on her own. Didn't get up. Cried at night. It helps you see the trend yourself, and it's invaluable information for your vet. And one last thing, let yourself grieve now. Anticipatory grief is a real psychological phenomenon described in clinical literature. Studies show that pet owners who allow themselves to process the loss in advance cope better after the death of their animal. This is not weakness. This is love. I want to end not with advice, just with words. Dogs live beside us in a way very few can, without conditions, without resentment, without past or future. Only now, only you. And when the end comes, they don't ask for much. They ask for one thing: that you be there. Don't try to fix it. Don't look for one more specialist, one more opinion, one more treatment. Just be there. That is more than you know. If this video found you in a hard moment, I hope it helped. Not made it easier? That's not possible, but helped you understand. I'm Dr. Demi. Love yourself, take care of your pets, and I'll see you in the next video.